Hi, I'm Dr. Keshishian, and welcome to our podcast series, PPE, Podcast for Psychoeducation During the COVID-19 Pandemic. I'm joined by Dr. Tamara Chambers, the Chief of the Department of Otolaryngology, Head and Neck Surgery at LACUSC. Hi, Dr. Chambers.
Hello, how are you?
Good, thank you.
Today, we're going to be discussing a topic that we've been reflecting on a lot recently, and that's racism, specifically as we can see it in the healthcare system. We'll talk about how racism may be experienced by those working in the healthcare field, how racism can potentially impact patient care, and hopefully uncover some ways we can all make a difference. Hi, Dr. Chambers. Can you tell us a little bit about yourself?
Hi, so yes, I am the Chief of Otolaryngology Head and Neck Surgery. I also work in the operating room as the Associate Director for Perioperative Services, and then also with the SAFE Committee, making sure that our residents and fellows on the LACUSC campus have a voice regarding safety, fairness, and equity. I actually was raised right here in Los Angeles, and I actually attended high school right across the street at Bravo Medical Magnet High School. So I've actually kind of been in and of this campus for a long time now.
So you're part of our community and neighborhood. What made you decide to become a physician? How did you end up a doctor?
It's funny. I actually wanted to be a pediatrician since I was 5, and I knew that there was this idea of being able to care for others, and I really liked science, and I knew I wanted to be a physician. I knew I wanted to be a doctor. By the time I went to high school, I knew I wanted to go to Bravo Medical Magnet, and it was there that I started actually doing research on the USC campus. I was actually doing head and neck surgery research regarding head and neck cancer patients. And so, kind of as I look back and I put it all together, I did realize that, being an African American myself in a place where you have so many patients that are exposed to billboards of Joe Camel and people that know more about Joe Camel than they do about Mickey Mouse, how prevalent alcohol and tobacco use is, particularly in, these underserved neighborhoods, which is like where I came from. I thought that being a head and neck surgeon would be a way to, kind of take the bench to the bedside and in fact to the operating room and be able to care for patients in a different capacity. I had a mother that really was into education, and she really fought into her last breath to make sure that education was at the forefront of myself and my sister. So that was always key. I unfortunately lost my mom. It's been probably 8 years now, but that legacy of education, of caring about others, of caring for people that don't have a lot or don't have, they may not give you anything and anything back, but you give and you try and do right by them anyway. So I think that those are some of the legacies and hallmarks of my mother. I've also been fortunate. I have a wonderful husband who happens to be a trauma surgeon who's been more than supportive, and also cares for patients that come in and are injured and wounded, and you do the best you can to care for them. So I think that those are, we're definitely a family of people that, you give and you give, not expecting anything back.
Thank you so much for sharing. Let me ask you, have you ever personally experienced racism in your career or in your education?
Yeah, I've actually been really fortunate growing up in Los Angeles. As I mentioned, I went to Bravo Medical Magnet, which was just this mixing pot of so many different ethnic groups. Everybody was different, and that was normal. I do realize that there's a real issue, particularly across America, and that you still do get exposure to microaggressions. But on the whole, I've been really fortunate to not have experienced, distinct and definite racism, I would say.
What about our patient population? How do you think they may experience racism?
I think that there's a difference when you have someone that looks like you, when you have someone that speaks your language, when you have someone that speaks to the cultural issues and the values that you behold. When you just throw medications at a patient and you don't really understand where they're coming from, how that how that medication is going to impact their ability to celebrate holidays or ability to interact with their family. I think if you don't take that into consideration and really consider the whole of that patient, and really try and deliver culturally competent care, I think that it's a really missed opportunity. And I think that's where compliance ceases. I think that's where, healthcare problems increase. Sometimes you see, patients become disenchanted with the healthcare system because it's just not going to work for them. And so, I think that that's something that you have to consider. And it doesn't necessarily only have to be the way that, that you necessarily look, but I think that that's a first connection. But if you can connect with that patient on some level of who they are and what they're about, I think that, you can provide better care for that patient.
Right. Do you have an example of culturally competent patient care?
Yeah, so it's funny, most of the time in my own clinic, I'm speaking Spanish for most of the day. And
Yeah.
and it's a rare opportunity where I'm actually, it's a challenge sometimes when I'm speaking English, when you see a patient, and sometimes a patient gets offended and you don't mean to offend them, but I'm so consistently speaking Spanish. So I think that kind of thing, I think understanding, sometimes people describe entities or symptomatologies or way that they present, they just describe them differently. And I think that if you can kind of understand that a little bit better, then you can connect and actually understand what the patient's trying to say, instead of, certain book answers or maybe what you read. If you can meet them somewhere where they are, I think that you're going to be better able to deliver the care that you hope to.
Okay, so let's talk about our patients. A lot of times it seems like the two terms underserved and minority tend to go hand in hand. What do you think we as a society or even as individuals can do to break that linkage between those two terms?
Yeah, I think it's funny. Minority is really a funny term. If you look at the 2010 census, minority, or sorry, Latinos in Los Angeles County make up 47.5% of Los Angeles County. So it's hardly a minority. But I think that we need to think about underserved. Underserved is a really all-encompassing term. It's not based on ethnic group. It's not based on demographic. It's really based on your ability to access healthcare and receive the care that you need. Some people are trying to receive healthcare and don't have money to be able to afford it. You also have people that work all day and all night and have to make decisions about obtaining healthcare and feeding their families or keeping a roof over their heads. So, those are the underserved. Those are the working poor. I think that we need to expand our definition, and not only expand our definition, but understand how we're actually going to improve the care for those people that are underserved.
Thank you for that explanation. What specific role do you think doctors and healthcare workers can play?
Yeah, so I think that we have this really amazing platform. Patients entrust us with their lives day in and day out. And I think that we can use that platform, in a lot of ways. I recently gave a speech actually at Grand Park downtown, speaking on this issue. And I kind of used this phrase of educate, advocate, and elevate. And I think that that's the thing that a healthcare provider can do. So I think we need to educate our patients and ourselves about health, about healthcare disparities, social determinants of health. And I think we need to think about how implicit bias plays into these factors in the care that we deliver. We also need to understand how and when to deliver the best and most effective and highest quality care, regardless of what our patient looks like. I think we need to advocate. We can use our platform also to advocate for healthcare reform and for policy change, and advocate for people to hold positions in office that reflect ideals and values that are similar to our own. And then finally, elevate. I think, reaching back into classrooms, being mentors, being advocates, being educators, we can really plant a seed that can affect young people and change their health and wellness for generations. And so I think that teaching love, teaching health, teaching wellness, I think that we can really be the change that we want to see in the world.
I want to go back. You mentioned implicit bias. What do you think we can do to be mindful of that?
Yeah, I mean, that's a big topic. And, it's something that we talk a lot about because there are inherent, situations that you bring to the table when you assess a situation. And I think you have to just be bring your own awareness. I think you have to be aware of the situation and realize that you are projecting, different biases onto situations. And I think that first starting with yourself and checking in with yourself about your own biases, I think that that's a really good starting point. I think if we all started there, we would actually be more mindful about our interactions and considerations with others.
Thank you for your thoughts. So we're in the middle of a pandemic. How do you think the COVID-19 pandemic has highlighted racial inequities?
Yeah, so with COVID-19, I think that we're hearing a lot of things from the CDC and the NIH, for example, about how there are these healthcare disparities. And I look forward to hearing more about how they figure out, why are certain ethnic groups more predisposed to it. But we do know that some of our underserved are essential workers. That are, having to put themselves into the flame and into the fire, and in order to continue on with our society. There are bus drivers, they are our grocery store workers, and so we know that they had increased exposure. We also know that some of our underserved are multi-generational families that are living in one unit, and you're asking people to socially distance, you're asking people to wash hands, you're asking people to use hand sanitizer, all of these things that people may not have access to or might have to make decisions about if they're going to use one or another. And sometimes by the time you figured it out, maybe somebody was already infected, maybe the oldest person in the family was already infected. So that's been really challenging. We also know that our underserved patients oftentimes, therefore had lower or less access to healthcare to begin with, and usually present to our healthcare system with many medical issues, multiple medical problems. And we also know that those patients are also the ones that suffer from COVID worse than, our healthy, counterparts. So, all of these things, you're seeing underserved people, you're seeing people that, have racial inequities, all of these put together that, you're starting to see it just being highlighted with the pandemic.
That all makes sense. So thinking about all of that, what do you think we can do to advocate for our patients and for each other?
Social workers have their work cut out for them. Social services have their work cut out for them. Trying to help with housing, trying to help, unfortunately, by the time patients come to the hospital, it could be too late. What we're doing a lot of is trying to work with our primary care clinics to reach out and do outreach to keep people at home. If somebody does need to come to the hospital, that they're able to access whatever healthcare they can. We're using telephone visits, for example, to keep people away and still allow them to continue their care. We have pharmacists that are mailing prescriptions and medications so that people don't have to come into the hospital. We're doing drive-through vaccinations. Vaccinations are really, really important. We need to look forward to September when we're going to have the flu coming. And every year we've had the flu. And this year will be no different, but the flu and COVID together can be really, a huge, very detrimental to our underserved patients. So we need to continue to do vaccinations and do vaccination outreach. So I think all of these things, not just inside of a hospital, but really trying to expand our borders and resume the care that we already provide.
Right, medicine has really changed and adapted so much. How do you think that we can be more supportive, especially during this difficult time?
Yeah, I think that I think it's fair to be honest with patients and just say, I know this is a troubling time, and allow for those dialogues. It's uncomfortable for everybody, but I think that it's through that discomfort that you can grow. And that there's the most opportunity for growth also. So I think just meet people where they are. Regardless of if you wear a white coat or not, we all put on our pants one leg at a time, and just meeting people where they are with humanity. Understanding that everybody is challenged and going through stressful times, and just being honest and forthright with that. And I think that you can actually build a better bridge and a better connection.
Thank you so much for all of your thoughts. Do you have any memorable positive experiences, any special moments you can share with us?
Every day that I come to the hospital, which has been every day, I am really overwhelmed by the human spirit. I did a tracheotomy today on a COVID positive patient, and I said to the nurse, I said, you're the MVP, and thanks so much for showing up. And and she thought I was making a joke, and I guess she was on a video and she thought I was kidding. And I said, no, I said, other people realize it too. You are the MVP, and everybody, instead of staying at home, they ran to the fire. Everybody here has sick days. Everybody can call out. Everybody can do all kinds of things and still keep their jobs. But everybody every day comes into this hospital, comes across this bridge, and shows up. And that just shows the genuine human spirit to care for others. And so every day I am reminded by that. And that's the light at the end of this tunnel, is that we are all in this together. And that people daily sacrifice themselves and their lives to come in and care for those that cannot care for themselves.
Very well said. It is a very interesting time for humanity. I want to personally thank you for the sacrifices that you make, and thank you so much for joining us today. It's been an absolute pleasure.
Thank you so much. It's my privilege and my pleasure.